Good afternoon to one and all present here. Welcome to our sixth session on promoting research ethos in higher education. Today we have with us Dr. K. Kumaran, who is going to present on the topic preparing research proposal. To introduce Sir is currently an associate professor at the MRC Life Course Epidemiological Unit, University of Southampton, UK, and a unit head and senior scientist at the Epidemiological Research Unit, CSI, Holsworth Memorial Hospital, Mysore, India. After qualifying in medicine, Sir has been closely involved in setting up the initial collaborative DOHAD, which is Developmental Origins of Health and Diseases Studies in Mysore. He subsequently trained in public health in UK, obtaining a MS in public health and membership of the Faculty of Public Health. He worked at consultant level for Health Protection Agency, where he worked on communicable diseases control and environmental hazards. He also held a consultant post with NHS Somerset, where he was the lead for public health intelligence. He has a keen interest in teaching and has been involved in the development and delivery of undergraduate and postgraduate public health teaching at the Peninsula Medical School after completing a postgraduate certification in clinical education. He returned to India in 2012 to work on various Indo-UK collaborative projects related to DOHAD. He has since been closely involved in a community-based preconceptual micronutrient supplementation trial in Pune, and in follow-up of children born in preconceptual community-based supplementation trial of micronutrient-rich food amongst slum dwellers in Mumbai. His long-term interests include the application of multifaceted, evidence-based population-level interventions to improve fetal growth and long-term health using a life course approach and teaching and training initiatives. He has been involved in a number of grants totaling over £10 million. He has published 75 papers and book chapters and a textbook on epidemiology and public health. He is a peer reviewer for UK and Indian grant agencies and for a number of journals. He is currently the secretary of SNEHA, Society for Natal Health Effects on Health in Adults, India. We welcome you, sir. We look forward to an enriching session with you.
Thank you. Thank you so much for the kind introduction. I'm aware this is a very mixed audience, and my examples will be focused on health because that's what I know, and my research has essentially revolved around maternal and child health, basically human health. So although the examples will be drawn from the health field, the principles of research, literature search, the study design and writing it up should be applicable to all fields. So you'll have to excuse me for using purely health examples because that's what I know, but I think the principles can be translated to all of your fields. And I'll try and finish in about 45 minutes so we have some time for questions at the end. So are the slides visible now?
Yes, sir, it is visible.
Yeah, okay, great. So, as was mentioned, I've done a lot of teaching previously, and the slides, as always, include the contribution of many close friends and collaborators who are all mentioned here. So, my research is basically around human health, epidemiology, and in that we mean by studying the patterns of diseases and how diseases occur in populations. And we can basically describe everything by time, i.e. when it occurs, place where it occurs, and the person in whom it occurs. So by time we mean it could be seasonal, it could be sudden outbreaks like the current pandemic we are having now of coronavirus. place could be geographically, it could be countrywide, it could be statewide, it could be much more localized. And person, the way we describe a person, whom does it affect? Age, sex, socioeconomic class, whether they have any underlying conditions, whether they have any specific uh, genetic mutations, etc., etc. So by trying to cover this, you can basically describe any condition or disease. And if you take it from a communicable disease point of view, everything revolves around three aspects. One is host. Host is the person who gets the disease. So for example, if we are taking coronavirus as an example now, the host will be humans. The agent is the actual virus itself. And the environment are the factors that can either promote disease or can prevent the transmission of disease. So the purpose of any research really is to find out about entire population. So that's what we are really trying to do here. But obviously you cannot do research on whole populations. It would be impossible if I wanted to do a prevalence study of diabetes across the whole of India. So what do I do if I want to do that? I select my sample based on my population of interest. So if I'm interested in doing a study looking at the prevalence of diabetes amongst resident in Mysore, I can't go and do my study on the entire population of Mysore. So I'll select people who are representative of the population of Mysore, collect my data. Then from this sample, I will analyze the data and draw conclusions that will be applicable back to the population of Mysore. And you can do that with two populations. So if you want to compare two populations, let's say you want to compare the population of India with the population in the UK and look at the prevalence of diabetes. Again, because it's not going to be possible to do it on whole populations, you select your sample based on your average Indian population, your average UK population, collect your data, compare them, draw conclusions, and then extrapolate it back to the two populations. So that's basically what we are trying to do with any research study. So you have to identify your population of interest first, and that's really the first step. So now, what are the applications of research? Why do we do research? So from a health perspective, you can broadly divide them into three main factors. You want to identify factors that cause the disease. You want to assess whether a treatment, or sometimes it can even be used to assess side effects, whether a treatment is effective. And thirdly, it helps you to monitor and plan public health level interventions. So I'll give an example for each one very briefly before we go on to the how we go about developing a population, because all this forms background for that. So this is a very famous study which was led by two scientists called Hill and Dahl. They were the first ones to show a relationship between smoking and lung cancer in London in the late 40s, early 50s. And what they did was they followed up a group of doctors over a period of time. So this results are after they followed them up for 40 years. So when they looked at, so they were publishing their results every 10 years. And the slide I'm showing now is from the 40-year follow-up sample. So the line at the top, these are all survival curves, or the percentage who remained alive in each of these groups at the end of specific periods. So you can see that the top line, which is the darker line, those who never smoked regularly had a much higher chance of being alive at any particular time point. And those who were smokers had a higher risk of death. But even within smokers, you can see that there are differences. So lighter smokers, for example, were less likely to die compared to moderate or heavy smokers. So this is an example of a research study where we are trying to identify what causes a disease. So in this case, we associate smoking as a risk factor with deaths or from lung cancer. The other main use of health research or research is to look at the effect of something. So in the health setting, it's always treatment. In your individual settings, it could be anything, but you're essentially trying to see whether something works or doesn't work. So this is a very famous historical study. This was actually the first documented randomized controlled trial. So in medical research, Randomized controlled trials are considered the gold standards for assessing treatments. And this study by James Lind on scurvy was one of the first of its kind, which was actually well documented. So what he did was, in those days, sailors were falling ill and dying from scurvy, especially when they sailed out to sea. So what he did, on a particular ship, he grouped sailors into 6 groups. It was a small sample size. There were only 12 sailors. So he grouped them into 6 groups of 2 sailors each. And for each one of them, he gave a different treatment. And the ones who were given oranges and lemons not only remained well, they were well enough to look after all the others who fell ill. So this led to the idea that fresh fruit, especially citrus fruits, could actually prevent people from getting scurvy. It wasn't really 150 years after that that we actually discovered it was because of vitamin C. So it again shows that research can help people come up with a treatment or with a cure, even without really understanding everything about a particular disease or the actual cure. The third broad application is about public health interventions, much larger scale health interventions. And again, I'm using health as an example, but you can look at finance, for example. Finance, you can look at similar examples. So this is a very historical disease again, because it was the first infection which was controlled by mass vaccination. As you can see at the beginning of the slide, you can see these peaks and troughs. When any infectious disease, when it enters a population, hits a peak. And then after a certain amount of the population become immune to it, i.e. herd immunity develops, the disease then starts tailing down. So you might have all heard of the concept of herd immunity now, particularly with all the COVID information that is coming out. So once herd immunity is reached, the disease stops dropping down until there is a sufficient pool of population built up again. And then once there are enough people who are again susceptible to the disease, and if the disease re-enters, you can have another peak. So this is the typical pattern for any infectious disease until vaccination is introduced. And once vaccination was introduced in the 1940s, you can see that both deaths and the notifications of the disease tailed off dramatically. So it's a bit difficult to make this interactive because I can't, I can only see my screen at the moment. But this infection was actually diphtheria. So diphtheria was the first infection to be controlled by mass vaccination. Similarly, when we look at effects, you can look at vaccine coverage versus a particular disease. So in this case, we are looking at pertussis, which is commonly called whooping cough. So again, you can see a similar pattern of peaks and troughs until immunization is introduced, and then it drops off. The line on the right-hand side of the chart actually looks at vaccine coverage. So as you can see, when the vaccine was introduced initially, it had high coverage. And because of some scare in the 1970s, the vaccine coverage rate started dropping off. People did not get themselves vaccinated. And that is mirrored again by an increase in the rates of the disease. So this kind of research helps us to identify one of the possible reasons behind why a disease might be recurring, i.e. because vaccine coverage rates are falling off, we can see an increase in the disease. And you might have read in the last few years about resurgences of infections like measles and mumps, particularly in the Western world, because of rates of vaccination falling off. So now I'll go into how you go about developing a research proposal. The first key thing is really to identify an appropriate research question. And I can't stress how important this is. So there are many ways of identifying what is an appropriate research question. But the first thing from all of your points is to make sure that you are actually interested in that research question. If you are not interested in that research question, don't do it, because you will not be able to do it well. So once you decide on what your area of interest is, there are other factors that you have to consider. So one is, again, I'm going from a health perspective, but these generic principles are applicable to all your fields and professions as well. So the one is the importance of the problem. How big a burden is it? Is it really a large, is it really a significant issue? Or is it something so minor that it affects very few people, and therefore, we may not be able to do research on it? Now, from a disease point of view, even if very few people are affected by it, it is important to the people who are actually affected. But research is slightly different. You have to look at the burden of the problem. Is it a national or a local priority? Because again, it makes sense for us as researchers to dovetail in with something that is either a national priority or a local priority. The third issue that we always consider when we are identifying questions is to look at funding streams. Is there going to be funding for this research study? Because uh, those of you who have tried doing research will realize funding is one of the biggest issues whenever it comes to developing and delivering any research study. And the fourth issue is special circumstances. So where something comes up as a major public health issue and there's a lot of focus on that. So at that time, it might make sense to focus on that particular issue because it's important, it becomes a priority, and there will be funding available for it. So currently, for example, you can see that there's a lot of research going on around coronavirus and developing a vaccine for coronavirus. That's because these are extremely unusual and special circumstances. It's a major public health issue worldwide. It's a national priority for all countries. All funders are diverting all their other funding streams to coronavirus. And so it's a very good, there's very little known about coronavirus. So it's a very ideal set of circumstances if you want to do research in that area, for example. So I'll talk about how you go about developing a research question. So first is to identify a problem or a burden. So let's say your question is, should a baby be immunized against certain diseases with a vaccine? I've just chosen MMR as a vaccine example. So you then try and split your question into your population of interest. So this is called the PICO format, PICO. Then your intervention or your exposure of interest and a comparison group. It's very hard to do anything on single groups. So you will need a comparison group. And then finally, you will have to decide what outcome you are interested in. So breaking this down further, for measles, mumps, and rubella, your population of interest is likely to be toddlers or children up to the age of school entry. Your two groups will be a group which gets vaccination versus a group which doesn't get vaccination. And the outcome is something that you can choose. So you can say, you can look at the risk of the disease, you can look at the morbidities or the complications associated with the disease, you can look at the complications associated with the vaccine, and sometimes the vaccine itself can cause disease. So you can look at that. So there's a range of stuff you can actually choose. Again, it depends on what you are interested in when you choose the outcome. What is of interest and importance to you may not necessarily be an outcome that is interesting to somebody else. So you have to choose what outcome you are interested in based on either your clinical judgment or your research interest. And again, for every research study, remember there are going to be trade-offs. So in this example, when you compare the immunized and the non-immunized group, in the immunized group, you would assume that they will have a decreased risk of the actual disease itself. But then there is always going to be some risk of some side effects associated with the treatment. Similarly, for the non-immunized group, they are going to have an increased risk of the disease itself, but they obviously won't have any side effects from the treatment because they haven't taken the treatment. And you ultimately have to decide on what you feel are the trade-offs. Is the risk, is it better to have a decreased risk of the disease and take the chance that there might be some side effects associated with it? Or do you go down the line of, no, I don't want any side effects associated with it. It's actually better to get the disease. So again, these are sort of philosophical judgments, health judgments, practical judgments that one needs to make. So once you have identified your research question, so remember, once you identify your research topic, convert it into a research question. So for that, you need to identify your population of interest, what actual intervention, treatment, risk factor you're interested in, a comparator group, and then what you're going to actually assess as the outcome. So without choosing a proper outcome, you cannot design your study. And choosing the right outcome is important, because if you've got a duration of 3 months or 6 months to actually do your study, you cannot choose an outcome that takes 10 years to develop. So for example, you can look at the effects of treating somebody with antibiotics to cure upper respiratory infection, because you're going to, antibiotics are normally given for 5 or 10 days, 5, 7 or 10 days, and you're going to get your results pretty soon after that. But if you wanted to look at a research study looking at the risk of, uh, following smokers and seeing how many of them develop lung cancer, that's going to take years. So it is well beyond your time frame for completing your research projects. So choosing the right outcome and choosing the right time frame for the outcome is very important. So the second one is, once you have decided on your topic, what is the current evidence? What is known about it already? And this is quite an important aspect, because remember, most research is actually incremental. We make small little steps in progressing. Very few people are good enough or lucky enough to find out something that's completely new and completely novel. Most of us work, there's a famous saying in research, you stand on the shoulders of giants. So you try and follow up what people previously have done and identified. So for example, in our field, the developmental origins of health and disease, all the incremental efforts that we are making have their roots in Professor David Barker, who actually came up with this field about 30 odd years ago. So most research is incremental, but you need to know what the current state of play is. So for that, you have to do a proper literature review. I'll go through some of the steps you need to do for this. But again, remember, I'm talking about this from a health aspect, and you will have to make this applicable to your own settings. So your literature review has to be critically appraised. So it's not just summarizing what you find in the papers. You have to say whether it's good enough to be used and what can be used and what can't be used. It's always very easy to pick a paper to pieces, but what's more important is what you can get out of it. So it's important to be critical, but also try and get what you can from previously published literature. So the first thing is the findings. How good are the findings? So is this actually valid? Is this actually reliable? So these are slightly different. They have slightly different meanings. Validity refers to the conduct of the study. Reliability refers to how repeatable is it. Is it just a one-off finding in one particular population, or is it more generally applicable? And finally, is it actually relevant to your question and your research area of interest? So for this, you have to learn how you critically review the literature. Again, there are sessions on critical appraisal that some of you may be familiar with, or certainly I know that some specialties certainly do this. So it's important that you're able to read a paper, critique it, and take what is relevant for you out of a particular paper. But there are some problems with this, because you might have a question on which there is actually very little evidence. The quality of research can be very variable. Just because something is published in a major medical journal doesn't necessarily mean it's a good paper. Just because something happened to be published in a slightly more obscure or less well-known medical journal doesn't mean it's a bad paper. So you have to learn to assess and appraise the quality of the research papers to be able to use it. And when it particularly comes to clinical trials, many of them have limited applicability. They might be applicable in those specific research condition settings, but they may not necessarily have much applicability in the real world, particularly in the varied settings that you might be working in. So again, these are just sort of things to keep in the background when you're doing the literature review or literature search for your particular research questions. So I'll just give you an example of how you go about searching for it. So let's say our topic is around steroids. Do they lead to less hospital stays or improved recovery in infants admitted with a particular bronchial or lung condition? So again, remember, you have to break this up into that PICO format I told you about: population, intervention, comparator, and outcome. So in this case, let's say we are interested in the population, which will be children who have bronchiolitis. The intervention is whether they're given steroids or not. The comparator group will have not received steroids, and your outcomes of interest can be either recovery or hospital stay. So when you search, there are two main forms of searching, and I'm not talking about searching on Google for this. I'm talking about searching on medical databases. So we use a text word and we use thesaurus. So text word searching is where you actually type in the word into your computer or the database, and it comes up if your text term matches the search you're doing. Thesaurus is slightly different. It's almost like a dictionary, and where each topic is indexed. So if you search under that particular heading, you can be absolutely sure you're picking up all the papers that are relevant to your particular research subject or area of interest. So the two, the common medical database that those of us in health use are either Medline or PubMed, and it's got specific names in that database. So similarly, you might all have databases that you are used to and you're using. And I'll just give one example. So heart disease, which is a very common non-communicable disease, can be referred to in many ways. People can call it coronary heart disease, people can call it ischemic heart disease, people can call it coronary artery disease, etc., etc. So if you type in coronary heart disease as a search term, as a text term, it will come up only with papers that have used that specific term. But if you go into the thesaurus, for example, and in Medline, the thesaurus term for coronary heart disease is ischemic heart disease. If you type in ischemic heart disease, it will pick out every paper that refers to heart disease. So it will pick up ischemic heart disease, coronary artery disease, everything, etc. So it makes sense to use a combination of both text terms and thesaurus terms, because the thesaurus terms will give you, will make sure you don't miss anything major. The text term gives you the flexibility. So again, I'm just illustrating this as an example of how you can show this. So the first example is where we are using text terms, and the last row is where we are actually using the thesaurus or the subject heading terms. So if you wanted to use it as a text term, you can just say recovery or hospital stay, or you can use it with a truncation. Whereas if you were using the thesaurus term, the term that covers both of those is called hospitalizations. So you can then combine all of them, and you can combine them by using a combination of and, or. When you combine all of this together, this is how the text search will look like. And you can also set limits. So it allows you to limit your search by a specific type of article, journal, study, language, etc. So for example, you might want to restrict your findings only to papers that have been published in English. There's no point in looking for journals in French or Chinese if you can't read or understand French or Chinese. So it also allows you to limit your search by looking at the specific type of questions and studies you want to do. So for the questions that we have just looked at, we might want to look at only clinical trials, for example. So if you do all that, it then gives you a much more manageable number of papers to read through. So if you just use a general search, for example, which is the first row of words here, you'll see we've come up with 43 studies. Now 43 is actually not too much, but sometimes you can come up with hundreds and hundreds of papers. If you then limit it, or if you're even broader, you can see that the second one, which just looks at specific types of studies, you get a huge number. But when you combine them, you're actually coming up with a much more manageable number of just 10 papers to read through. So again, I'm just mentioning some electronic sources for you to, that we tend to use in health research, but I've also given some additional ones that are used in behavioral sciences or education, for example. So each of your fields may have a particular database that you choose to use or search. So the third aspect of your proposal is actually now designing your study and how to write it up. So what do you need to design your study? So let's say, I'm just again giving an example. There are some people who go to a party, eat the food there, and then some of them fall ill. So we've now collected information on what they ate. So here your outcome, what you're interested in is the illness, and the risk factor or exposure is the various food. If I show you this table, what do you think may have caused the illness? Anybody wants to answer? Anyone feel like answering? Okay, I can see some text. Everyone saying bread. Okay. Anyone has a different answer other than bread? Somebody is saying fast foods. Okay, but we don't have any fast food example there, I think. Let me just check. Okay, I don't know whether cake would be considered fast food. Okay. Let me show you the next slide. Now you've got a comparison with people who were not ill and who also ate the same foods at the same party. Right? So you've got 70% eating cheese, both 70% eating cheese, 50 and 55% for tomatoes, etc., etc. So now what do you think caused the illness? Yeah, somebody said quiche straight away. So that's absolutely correct. It's the quiche. And the reason we know it's the quiche is because that's where we can see the difference between the two groups. So again, when you're designing any study, it's always important to have a comparator group, which also goes back to how we frame our research question. We frame our question around an exposure or a risk factor and a comparator group who doesn't get that. So if you're doing your studies on just one group of people, you cannot make meaningful conclusions. The comparison group is extremely important. So if I told you 80% of smokers will have lung cancer, by itself it doesn't mean very much. You'll say, so what? And it wouldn't be very interesting if 80% of non-smokers also end up with lung cancer, right? The relationship between smoking and lung cancer is interesting only because smokers have a much higher chance of getting lung cancer, whereas non-smokers have a much lower risk. So the risk could be, let's say, 10% in non-smokers and 80% in smokers. And that's what makes it interesting. So remember, for any study design that you're thinking of, you have to have a comparison group. So how can you conduct studies? So broadly, again, it doesn't matter which field of profession you're in. There are two studies. One is studies, what we call studies of association or observation, where you as the investigator just observe. You don't interfere in anything. The second one is studies of experiment, where you as the investigator are actually involved in allocating people into a control group or an intervention group. So you are much more involved in telling people what to do. Whereas in an observational study, people self-select themselves into various groups. So you are only observing them. So an example is, if you want to look at the relationship of smoking and lung cancer, you identify a group of smokers, you identify a group of non-smokers, and just observe to see how many in each group want to get lung cancer or heart disease. Ethically or practically, it would be impossible to tell people you smoke and to tell people you don't smoke. You can't do that. So such studies are called observational studies. You're just observing natural phenomena. You're not intervening. But if you want to test the effect of a new drug on an infection, so let's say a new antibiotic comes up that is going to be very effective against malaria. So in those cases, what you will do as the investigator is to divide people into two groups. You will give one group of people the current standard drug treatment for malaria. You'll give the other group the new drug, and then try and compare. So in the second instance, you as the investigator are actually intervening or actually allocating people into which group they go into. So that's called an intervention study. And again, whichever field you're in, broadly, there are only these two types of studies: observational studies and intervention studies. So there's basically two types of research: primary research and secondary research. Primary research is where you as the investigator is going to collect raw, fresh data yourself. Secondary research is where you're actually using somebody else's data or data that has already been collected. So from the point of view of developing this research proposal, I'm focusing on primary research, where you will develop a study research proposal and you will collect raw or fresh data. So there are broadly two types that you can divide the data into. Data that you collect at an individual level. So on every individual in the study, you will collect data, or you can collect data at a much larger level, at a group level. So those studies are called ecological studies, and I'll show you an example slightly later. And then once you collect individual data, you split them into these two broad studies I told you about, observational studies and experimental designs. So these are some examples of study designs. I saw in your syllabus that you actually have sessions on qualitative and quantitative study designs. So I'm not going to go into any great detail. But basically, a cohort means a group. And a cohort study design is where you start off with people who don't have the disease. You split them into two groups, those who are exposed to a risk factor and those who are not. So our smoking and lung cancer is a classical example here. So your group will be, your exposed group will be smokers, unexposed group will be non-smokers. And then you follow both groups over a period of time forwards to see how many in each group get the disease. Case control disease is slightly, study is slightly different. Your starting point is people who already have the disease and their controls who are people without the disease. And then you go backwards in time to ascertain a history of exposure. So these studies are done whenever you need information in a hurry. So for example, if you wanted to find out some risk factor for coronavirus, you could choose a group of people who have coronavirus infection, a group of people who haven't had the infection so far, and ask them for a history of something that you're interested in. You know, did they go to heavily crowded areas? Did they, you know, how frequently they wash their hands? Were they wearing a mask, etc., etc. A cross-sectional study design is a study design where you get information from your sample or a cross-section of the population at only one study point. So most of you will probably end up doing these studies during your research durations, because given the time limit that you have, it's probably going to be practical to do something like this. And any survey you can think of is a cross-sectional design. So whether you administer it by telephone, whether you administer it through a postal questionnaire, email, SMS, etc. So all surveys tend to be cross-sectional in nature. You're finding out information at one particular time point. It can just be descriptive. So you might ask people, you know, how many of you are washing your hands every day? You can make it analytical. You can ask for history of hand washing. At the same time, you can ask for history of respiratory infection and then try and correlate the two and show that those who wash their hands more frequently had lower rates of respiratory infection, for example. That will be building an analytical component into your survey. And the major type of study design for assessing intervention effects from a medical point of view is what's called a randomized controlled trial. If you look at the design, it's not dissimilar to a cohort study in the sense you have two groups of people, each of whom gets a completely different treatment or intervention. The only thing you're doing here is you're allocating them randomly into each group. So it's almost like tossing a coin or a dice. And depending on luck, anybody can go into either of these two groups. And then you compare the effects of either the intervention or the comparator drug on the outcome that you're interested in. I previously mentioned something about ecological studies, which again, it might be possible for you to do within a short time span, because most ecological studies use data that's already collected. So, but you don't have individual level data. What you have is variables that are measured at a group level. So for example, you can measure average intake of salt in various countries. And you can measure intake of salt from, let's say, salt sales, or the amount of salt that's exported, or the amount of salt that is actually taxed. So various ways of getting that, and get average blood pressure measurements from, let's say, World Health Organization surveys. And then you can draw something like this, which is where here each point will actually represent a country, not an individual. And you can show that as the salt intake of a country increases, on average, they might have higher blood pressure. Again, these are just illustrations, but it's something like how you might be able to do an ecological study. So which study design should you be using for your research proposal? There is no best study design. It just has to depend on the nature of the study question and how feasible that design is going to be in that particular context. So sometimes the ideal study design for your question may not be feasible, in the time duration you have, with the funding you have, for any number of reasons. So you might have to make compromises, and that's okay. There's nothing wrong. It's very hard to do an ideal study given time constraints, funding restrictions, etc., etc. So you just try and do the best you can given your limitations. All you have to do is make sure you can actually justify it in your research proposal. So I'm just very briefly going to touch on two factors which are important for any study. One is confounding. It is where something can be associated with both the risk factor and the outcome and can serve as an alternate explanation for the results. So, for example, you might find there is a strong association between people who drink heavily and lung cancer. But biologically, there is no relationship between alcohol and lung cancer. What is happening is people who drink alcohol heavily might also be smoking more, and that's the real explanation. So that's called confounding. So you have to make sure that you think about possible confounders when you're designing or analyzing your study. And the second one is something called bias, which is basically a design flaw in the study. And broadly, there are two types of biases. One is it depends on whom you select, and the second one is it depends on how you collect the information. So if you use the wrong tool to collect information, or if you do your study on the wrong group of people, again, you can get wrong results. And once you allow bias to enter your study, it's very hard to correct it later. I'm not going to go through this because they're more technical, but broadly what you can think of is any study is going to have some amount of error, what we call random error. No study is going to be 100% perfect, but bias means a systematic error. So in this example, the top left-hand side is where all the values are around the true result. So that's a good study. There's low random error, there's low systematic error. The one below that, there's no real bias, but it's a very poorly done study because the results are all over the place. So there's a large random error there. The top right one is actually quite dangerous because the results actually look very believable, but it's a very biased study. So you might end up with wrong conclusions if you do a study with that. And the bottom right one, again, it's easier to dismiss because it's a bit more scattered. But they are all on one side, so you can say there is some bias there. So when you start writing up your research proposals, I'd recommend you write your abstract at the end. Start off with identifying your main question. Your literature review will help you to justify it, to identify the gaps and what your hypothesis is, your aims and objectives. What are you going to do within the short time frame that you have? And remember what I said, this is incremental. You don't have to do something that's, if you get a great idea and it's completely novel, that's fine. But most of the time we try and add to existing knowledge and just make that little, make that little bit contribution to additional knowledge in that particular field. Think about your methods, which study design you're going to use, what the results say, how you will interpret it, and then the discussion and the conclusion. So what you will cover in the introduction or background is its importance. That has to be the key thing first. And then your literature review, which will go back to what we have discussed previously, the questions and the aims and objectives. The methods. So describe your methods in a very detailed manner, because most research proposals fail or succeed on the basis of the methods. This has to be the strongest component of your proposal. Where are you going to do it? What is your population of interest? What type of study design are you going to use? We discussed study designs briefly. What is the sample size you will need? Who will be your sample? I'm not going to go into sample size calculations here because that's a separate session in itself. What will be the time frame that you have? When are you going to do it? How long will you need to do it? How are you going to do measurement, to try and avoid the bias that we talked about briefly? and then develop your data collection forms. I'm aware my colleague Dr. Krishnaveni has already touched on ethics previously, so I'm not going to go into ethics at all. And then what statistical methods are you going to use? You need to have a very clear analysis plan and what tests you are going to use. So again, try and keep this simple. It should be stuff that you are able to do it yourself. You shouldn't need to use a professional statistician to help you with your stats. So the stats you use should be relevant to what you want to find out, and the method should just reflect that. And then when you write your results, you'll need two sections. One is a general section where you describe all the general characteristics, and then something very specific about your research topic. And when you write your discussion, you summarize. The first bit of the discussion has to be summarizing what you found. Then you compare your findings with previous studies or other studies that have been published. Critically appraise the previous studies as well as your own study. You have to have a section on the strengths and weaknesses of your study. And, every study is going to have strengths, every study is going to have weaknesses, and you will have to be able to reflect on it. That's what people expect in research proposals. And then finally, draw your conclusions. And then you'll need your references and then the appendices. So in terms of references, there are two broad systems that we use in health. One is the Harvard system, where we mention it by name of the author and the year. So if it's a single author, you refer to the full name of the author with the year. If there are two authors, you use and if there are multiple authors, you just use et al. And then at the end, when you're ordering your references, this is how you do it. The name, the year, the topic, and then the details of the journal. The Vancouver system, which is more commonly followed in quantitative medical journals, you generally tend to give a number in the text. You don't give the name and you don't give the year. You just give numbers, and you can give the numbers either in the form of brackets or as a super strike. And then at the end of the text, when you write the references, you start off with the name of the authors, the topic, the journal, the year, and then the other details, the volume number, page number, etc. So these are the two sort of broad methods we use for references. So to summarize, the first thing for any research proposal is make sure you can get a good question. A question that's interesting to you, a question that will be potentially interesting to the reviewers. Do a very good literature review and make sure you can identify gaps that you will be able to fill in. So and then make sure you choose a study design that's appropriate to answer that particular question. It doesn't have to be this study design versus that. You just have to choose the most appropriate study design, and then all the factors that we spoke about, writing it down. So I'll stop here now, and I think we've just gone a couple of minutes over. I'm happy to take any questions.
Thank you, sir. Thank you very much. Girls, you can post your questions in the chat box, or you can unmute yourself and ask. So there is a question.
Yeah, there is a question already saying, how do we know that our study is bias-free? So it's a very good question. It's a very important question, and it's also a very difficult question to answer because essentially it depends on your study design. So when you design your study, you have to make sure that you're selecting the right sample or subjects who are reflective of the population that you're interested in, so that you minimize selection bias. So for example, if I'm interested in something that affects the general population, and I go and select all of my patients from a specialist cancer hospital, they're not going to be representative of the general population. They are in a cancer hospital because of certain specific features that make them different, slightly different to the general population. So to answer a question that I want to be applicable to the general population, if I go and pick a very specific set of patients from a specialist cancer hospitals, I may not necessarily get the right sample. So that's an example of selection bias. Similarly, measurement bias. Again, how can you eliminate measurement bias? One is making sure that the instruments you use are appropriate. So if you're using a blood pressure instrument, make sure that it's a good quality blood pressure instrument, that it's regularly calibrated, that your staff are trained to measure blood pressure, and collect the information in exactly the same manner in everyone. So bias will be introduced if you collect data differently. So in one group, if you're collecting data by face-to-face interviews, and in your comparator group, if you're collecting data by questionnaires or by postal questionnaires or by telephone, you are necessarily going to get differences. And that might lead to some bias. So that's how you try and minimize bias. So one, select your subjects properly, make sure the instrument you're using, whether it's a questionnaire, whether it's an equipment, that it's good quality, the questionnaires have been validated, the equipment is calibrated, etc. Staff are trained. And thirdly, that you administer it in exactly the same manner to everyone. I've just seen another question which says, how can we rectify the bias in our research question? I'm afraid you can't. So if a study is biased and bias has already entered the study design, it's very difficult to rectify it afterwards. Confounding is slightly different. As long as you've collected data on confounding, you can adjust for it in your analysis plan. But if a study is biased, I'm afraid there's nothing we can do about it later. So shall we also include scope and limitations of the study in the proposal? Yes, you can. Scope you can certainly include. Limitation, it depends on how much information you have at that point of time. I would certainly put the limitations when you're presenting the final results, and certainly in the discussion. Whether you have enough information to present it at the proposal itself, I don't know. I guess it depends on the question. So results and discussion here, I was referring to the final submission, after you've done the study. At the proposal stage, all you will need to, results and discussion at the final thesis. But at the proposal stage, what you will need to do is present an analysis plan of what results you're likely to present and what form the discussion will take.
Girls, any more questions? Sir, how long should be the literature review in the proposal?
You mean in terms of length?
Yeah, length. Because we have it in a full chapter. So in the proposal, how long, how lengthy it should be?
Do you have a word limit?
Limit, yes.
What's the word limit?
Limit in the sense how lengthy it should be.
No. I mean, are there any guidelines for, for example, when we write grants, we are always restricted by what the granting body wants. So sometimes they say at the initial proposal stage, the whole proposal should be maximum of 4 pages. And then when we put in the full proposal, they say it should be a maximum of 12 pages. So depending on how much you're allowed, it's a matter of judgment. But what I would normally do for the at the outline or the submission of a proposal stage is really to focus on the background, literature review, and the methods, and keep the results and the discussion sections quite short. When you're actually writing the final report or the final thesis, then obviously that will change. Your results and discussion then become much more important.
Thank you. So these are undergraduate students, and
Right.
most of them will be doing their research in terms of a review of literature.
Okay. So that will be the main.
Yeah.
Okay.
So at in the first semester, they will have, this fifth semester, they have a subject called as recent advances in their particular fields, in their respective fields. So they will be doing a review of literature, and some of them will be actually conducting a study also, small study.
Small study, yeah. See, small studies are the best way to go about this. And when you say study, will most of them be surveys?
It's a small survey kind of
Survey
studies.
Yeah.
Survey. So teachers are giving them inputs regarding those like criteria, how they can do review of literature and how they can write a good research paper at the end of their study, basically.
Right.
And try to publish.
Yes. I mean, I would certainly encourage that, because when you're spending so much of time and effort writing your, doing your research project and your thesis, it's certainly worth trying to get it published. And, whatever you've done for your proposal, you can't exactly submit it to a journal as a publication paper, because it obviously has to be tailored. But it's not much extra work. You've done all the hard work already. So after that, it would be a shame not to get it published. I've just seen another question saying how we can identify bias in research proposals. So again, it comes with practice. The more you read papers and critique them, you will start identifying potential biases in the study. And then when you start writing or reading other research proposals yourself, you will be able to identify them. So basically, two things: look to see how the participants were selected, and look to see how the data was collected. That will help you to identify bias. There can be no other sources of bias. I mean, not no other, but those are the two major things that we come across. So, I mean, I'll just give a very example. Might sound silly, but let's say if I'm looking at how many people would potentially buy very expensive designer clothes, something like Armani or something like that. And if I go to a very posh area in Bombay where film stars and extremely rich people live, and ask them how many of them are wearing Armani or Gucci, for example, I'm likely to get a different set of results. If I go to a slum in Mumbai and find out how many people are wearing those clothes, I'll get a very different set of results. So that's an example of bias. Depending on the population you choose, you can get very different examples. But if you want to find out overall in the population how many people wear such clothes, you will have to choose a much more representative population. So that's an example of selection bias. How can we carry ethical research online, and is Google Form a reliable option? That's a very interesting question. Yes, you can carry ethical research online. You just have to make sure that whatever sources you are using to collect the data are secure enough. The principles of ethics don't change, whether you're doing it remotely or whether you're conducting face-to-face research. I think Krishnaveni spoke in detail about the conduct of biomedical research and ethics last time. So those basic principles don't change whether you're doing online research or whether you're doing face-to-face research. But it's just that you still need to go through all the things of informed consent, making sure the data can be treated confidentially, people have the opportunity to withdraw, etc., etc. So when you're using forms that you're requiring them to send back, you just have to make sure that you can ensure that these are secure systems.
Thank you, sir. Girls, any more questions? So shall we conclude? Shall we conclude today's session? Okay. So on behalf of UGC STRIDE, Center for Research Capacity Building, I extend my gratitude towards you, sir, for conducting today's session on preparing research proposal and giving the insight on how the proposal should be drafted. And I think it will really help students. Though they are undergraduates, sir, but at the PG level, it will definitely help them. So I'm really very thankful to you, sir, joining from your place, that is Mysore, and we are really very fortunate to have resource persons from various places because the sessions are going online right now. So
Yeah.
thank you very much, and sir, we are looking forward for your association in future too.
Sure.
Thanks a lot.
No,
Thank you.
thank you all so much, and thank you all for all the nice messages that I just typed up. So thank you all. I've enjoyed doing. I've certainly enjoyed doing the session, so I hope it was helpful, at least to some of you.
Yes, yes, sir. Thank you. Thank you very much, sir.
Thank you.
Yeah. Thank you, STRIDE team. Thank you.